Okay, so we finished with the anti-infective. So today we are going to talk about pain medications. These are very commonly used in clinical practice. And so we'll look at them carefully. We have non-opioid analgesics, salicylates, acetaminophen, and then NSAIDs. So at the end of these series of lectures on pain medications, you should be able to list the classes of drugs used to control pain, and then outline the uses and the various actions of these drugs. And you should also be able to describe how they are absorbed, distributed, metabolized, and excreted. And then also talk about their drug interactions and adverse reactions. So drugs that are used to control pain range from mild, mild over-the-counter preparations such as acetaminophen to potent general anesthetics. So increasing in terms of complexity and then in terms of severity of pain. So acetaminophen is used for mild pain, and then the general anesthetics are used for very severe pain. And so they include non-opioid analgesics, antipyretics, and non-steroidal anti-inflammatory drugs, which are known as the NSAIDs. And then we have opioid agonist and antagonist drugs, and then anesthetic drugs. So when you take the non-opioid analgesics, these are antipyretics and NSAIDs. They are a broad group of medications. Apart from controlling pain, they also reduce antipyretic effect, that is fever. They reduce fever, and they also have anti-inflammatory effects. So we talked about inflammation, the fact that when there's inflammation, there is pain, there's reddening, there's swelling, there is heat or fever. And so these anti-inflammatories will control these components of the inflammatory effects. Now, they may be used alone or in combination with other medications. And they also have what we call a ceiling effect, meaning that there's a maximum dose above which there's no added benefits, and they don't cause physical dependence. You contrast that to the opioid analgesics when we get to them, and you realize that they cause the physical dependence, meaning it's like the patient can get hooked to it such that they are always requesting for them. But these ones are not like that. So when you take this particular group, the classes of drugs in this group are the salicylates. The prototype is aspirin. We all know aspirin is very common on the market. Then we have the para-aminophenol derivative, commonly called acetaminophen. And then we also have the NSAIDs and the phenazopyridine. So this lecture will talk about the salicylates, acetaminophen, and the NSAIDs, because that's what we commonly use in our setting. Okay, so let's look at the salicylate. So for the salicylates, the prototype is aspirin. Now, they are the most commonly used pain medications. So for salicylates, their emphasis is on pain relief. And they are regularly used to control pain and reduce fever and inflammation. They are usually cheaper than the other analgesics and readily available without a prescription. So they are what we call over-the-counter medications, or OTCs. And like I said previously, aspirin is the commonest salicylate. The other ones are listed on the slide. Sorry, put on the fan if you're sweating. So for pharmacokinetics, they are taken orally and they are absorbed partly in the stomach, but mostly in the small intestine. There are several forms of aspirin. We have the buffered forms, which are absorbed readily. Then we have the sustained release form, and then the enteric coated form. So for the enteric coated form, there's a coating around the tablets, which prevents it from being degraded by the gastric acid. And so it goes to the small intestine before the absorption occurs. It will come before the absorption occurs. So when you take in food or an antacid, it delays the absorption because the absorption starts in the stomach. So when there's food or antacid in the stomach, there's delayed absorption. Some can be given rectally, and they have a more erratic absorption than the oral ones. Once you take them in, they are distributed widely throughout the body tissues and fluids, and they are widely distributed in breast milk. They easily cross the placental barrier. So the import of this is that once it's distributed in breast milk, it means that if a lactating mother is taking aspirin, it's excreted in the breast milk, and the infant is also taking it whilst breastfeeding. Crossing the placental barrier means that it can have an effect on the unborn fetus. The liver metabolizes salicylates into several metabolites, and these metabolites are excreted by the kidneys. So the various salicylates have different mechanisms of action. But mostly what they do is that they inhibit the synthesis of prostaglandin. And this is what would reduce the inflammation. If you remember, go back to your pathology, you realize that there are lots of prostaglandins that are produced during inflammation, in addition to interleukins and cytokines. So what aspirin does and its other relatives do is by inhibiting the synthesis of these prostaglandins. So this is what will curtail the inflammatory process. Now, they reduce fever by stimulating the hypothalamus, in addition to reducing the production of the prostaglandins. And when they stimulate the blood vessels, and there's increased sweating. So this increased sweating will promote heat loss through the skin and lead to cooling of the skin by evaporation. So this is what would lead to the reduction of body temperature. And the particular prostaglandin that is inhibited is prostaglandin E, which is responsible for increasing body temperature during inflammation. Another thing aspirin does is it inhibits platelet aggregation. So if you look at the clotting process, the very first thing that occurs when the blood vessel is cut is a platelet aggregation. So this is also, again, this is also from pathology. And this occurs by inhibition of the production of thromboxane A2, which is necessary for platelet aggregation. So the platelets don't clump together to facilitate the blood clotting mechanism. So it means that if you're on aspirin, your bleeding time is increased. However, it's not all salicylates that have this effect. So the choline magnesium doesn't do this. So if you look at the pharmacotherapeutics, that's looking at what it does. It is used to relieve pain and reduce fever. And usually when you look at the type of pain that they relieve, they don't effectively reduce or relieve visceral pain. So visceral pain is the pain from organs and smooth muscle, or severe pain from trauma. Oh, my battery is low. Please give me a minute. Let me go and get the charger. Kevin.
Are there any questions?
I go take over.
And so to continue from where Doc was, as she was saying, looking at the visceral, they are the things that are being produced from the various organs, and they are not. If you can.
why no?
Are you okay? Yeah, hot. Okay. So now the fan is on. I'm sure you aren't you? All right. So if you look at what they do, they would also reduce elevated body temperature. So if the body temperature is normal, they wouldn't reduce it further. It is only when the body temperature is high that they reduce the temperature. Then they can also relieve headache and muscle ache. So if you want to try and understand this, if we are talking about visceral pain, an example of visceral pain is abdominal pain. For example, abdominal colic. So if a patient comes and complains of pain in the abdomen, for example, you don't give aspirin because aspirin will not relieve visceral pain, which is pain from the internal organs and smooth muscle. It rather relieve pain like headache or muscle ache. So let's take note of that. And very soon, I mean, when you're prescribing, you'd understand more what I'm talking about. And they can provide considerable pain relief in 24 hours. So they are typically used to reduce inflammation in conditions like rheumatic fever, rheumatoid arthritis, osteoarthritis, all those arthritis things. However, because of the anti-clotting properties, which we mentioned, whereby they decrease the platelet aggregation, it can be used in patients who have a myocardial infarction to prevent blood clotting. So if you remember from your pathology, infarction is when there's a blood clot which has prevented blood from moving to a part of the body. So if we say myocardial infarction, it means that there's a clot sitting somewhere which is preventing adequate blood circulation to the heart muscle. And so if you give something that prevents clot formation, then it helps to enhance blood flow and also used to prevent recurrence of the myocardial infarction. So you realize that patients who have had a heart attack before, they are put on aspirin and they take soluble aspirin every day. This is the reason why that is prescribed for them. So the most common adverse reactions to salicylates include gastric distress. So they have this vomiting, nausea, severe abdominal pain, and then bleeding tendencies. Okay, so other reactions are what we see here. There's Reye syndrome, which occurs when is given to children with chickenpox or flu-like symptoms. Take note of the hearing loss and the tinnitus as well. So because they are protein bound, any medication that is protein bound, there'll also be an interaction because they will displace these medications from their sites on the albumin and thereby lead to a potentiation of the effect of the unbound drug. Then there are some special populations that you need to consider. So aspirin is not recommended for use in children. And then we said that there's gastric distress or risk of gastric ulceration. So, I think this is supposed to be at the inside, it's not here. I would rearrange. I don't know how come. Okay, so when we get there, so the NSAIDs appear in breast milk, so it's not to be used in breastfeeding women. So a woman is breastfeeding, she's complaining of pain, you don't prescribe diclofenac, okay, because it's an NSAID. Yes. My phone is not ringing. I'm going to your food, please. Okay. Okay. So we've already talked about the anticoagulant effect. So when you take it with things like heparin, you increase the effects. Then also, there are certain drugs whose effects are decreased with salicylate. So spironolactone, or aldactone, commonly called aldactone. Then if you are giving them with corticosteroids, there's increased risk of ulcer because corticosteroids have a risk of ulcer as part of their side effects. So if you give it with salicylate, then you potentiate this further. Then medications that will alkalinize the gastric acid. For example, antacid would reduce the level of the salicylates. So for such medications, you'd usually give them either 1 hour before meals or 2 hours after meals so that there is no interaction with the gastric acid. So we go to acetaminophen. Now, acetaminophen is commonly called paracetamol, and this is a very commonly prescribed medication. So this class of drugs of para-aminophenol derivatives includes 2 drugs. We have phenacetin and acetaminophen. There is this medication that we commonly call APC. Now, APC contains aspirin, phenacetin, and caffeine. It's a very common over-the-counter analgesic. So we'll talk about acetaminophen because acetaminophen is the most commonly available of the 2. Acetaminophen is an over-the-counter medication that produces analgesic and antipyretic effects. So analgesic effect means that it reduces pain, and antipyretic effect means it reduces fever. So it appears in a lot of products designed to relieve pain and symptoms associated with cold and influenza. Acetaminophen is absorbed orally and completely from the GI tract. So if you take paracetamol, it's completely absorbed from the gut. And it is also well absorbed from the mucous membranes of the rectum. So in children, especially children who are vomiting or for one reason or the other can't take an oral medication, or maybe the child doesn't administer oral medication, you would usually give rectal paracetamol, and it's well absorbed from the mucous membranes of the rectum. So once it is administered, it is distributed widely in bodily fluids and readily crosses the placental barrier and can go and get into the fetus. It is metabolized by the liver, excreted by the kidneys, and you can also have small amounts in the breast milk. Okay. You can get paracetamol in breast milk. So what does it do? It reduces pain and fever, but unlike the aspirin, it doesn't affect inflammation. It doesn't affect platelet function, but it can cause anticoagulation in a patient taking warfarin. So when you look at the way acetaminophen works, it works in the central nervous system by inhibiting prostaglandin synthesis, and it also reduces the fever by acting on the heat regulating center in the hypothalamus. That's the thermoregulatory center. It's used to relieve fever, headache, muscle ache, and general pain, and is a drug of choice to treat fever and flu-like symptoms in children. In fact, paracetamol is very safe in children, and it's one of the most commonly used medications in pediatrics. And it's an effective reliever for some types of arthritis. So take note that paracetamol is a very good pain reliever. It's also very good for fever. But when it comes to the inflammatory aspect, it's not as good as aspirin or the NSAIDs. It's in the middle. So if you're taking paracetamol with oral anticoagulants like warfarin, their action may be slightly increased. And then it's also very important for you to take note of the fact that when the patient is on using alcohol, long-term alcohol use, the risk of liver toxicity is increased. So this is where your social history comes in. If you take the history and you realize that this is a patient who has been abusing alcohol, then you have to be very careful when you are putting them on paracetamol, because it means that the risk of liver toxicity is increased. And then also when they are taking medications like phenytoin, barbiturates, carbamazepine already, these can also increase the risk of liver toxicity when you take them with paracetamol. And then isoniazid is one of the anti-TB drugs. So it's important to exercise caution here as well. Then when you are given medications like lamotrigine, which is an anti-epileptic drug, loop diuretics, which is used for treatment or management of hypertension, and then zidovudine, the actions may be reduced when you take them with acetaminophen. So zidovudine is an antiretroviral drug. So adverse reactions are very few. In fact, most patients tolerate acetaminophen very well, and it rarely causes gastric irritation and doesn't cause any bleeding tendencies, but the liver toxicity is a problem, and so you need to monitor the daily dose. And the total daily dose shouldn't exceed 4,000 milligrams. So let's take a look at what this actually means. So we know that one tablet of paracetamol contains 500 milligrams. And so 2 tablets is 1 gram or 1,000 milligrams. And we are saying that the daily dose of paracetamol should not exceed 4,000 milligrams. It means that you cannot take paracetamol more than 4 times a day. I hope you understand, because each dose for an adult is 1 gram or 1,000 milligrams. So if you shouldn't exceed 4,000, it means you shouldn't go beyond 4 times a day. So 4 times a day brings it to every 6 hours, because there are 24 hours in a day. So every 6 hours, if you take the paracetamol every 6 hours, you'd have taken it 4 times in a day. So when you are prescribing, you need to be aware of this. So other adverse reactions are skin rash, hypoglycemia, and neutropenia. Okay, so we conclude with NSAIDs. So the NSAIDs is an acronym which stands for non-steroidal anti-inflammatory drugs. And they are typically, as the name implies, typically used to combat inflammation. And their anti-inflammatory action is actually as good as that of aspirin. So if, let's say, for one reason or the other, the patient cannot take aspirin, you can give NSAIDs when you're looking at inflammation. They also have analgesic effects and some antipyretic effects. But unlike aspirin, there's nothing like a permanent platelet aggregation effect. That effect is temporary. So when you look at NSAIDs, there are two types. You have the selective and non-selective. The non-selective NSAIDs are what we commonly have on the market: diclofenac, etodolac, brufen, indomethacin, naproxen, paroxicam. Those are very common on the market. They are non-selective. The only selective NSAID that is on the market is celecoxib. The common name is Celebrex. Yes, Celebrex is what we commonly have on the market, and it's a selective non-steroidal anti-inflammatory drug. So all of them are absorbed well in the GI tract, and they are metabolized in the liver, excreted by the kidneys. So in order to understand the side effects or the reason for the selectivity, there are two isoenzymes of cyclooxygenase, and cyclooxygenase is an enzyme which converts arachidonic acid into prostaglandins. We've learned that prostaglandins have a key role in inflammation. So these NSAIDs block the cyclooxygenase 1 and 2, which are involved in the conversion of the arachidonic acid to prostaglandins. So once they inhibit these enzymes, it means that the prostaglandin will not be produced, and therefore there will be no inflammation. Now, the non-selective NSAIDs, they block both the COX-1 and the COX-2. And the selective NSAIDs block only the COX-2 enzyme. Now, I don't know why the slides are mixed today. I'm sorry. Okay, so let me explain it. So the COX-1 is involved in production of prostaglandins that protects the stomach lining. And the COX-2 is involved in production of prostaglandins that are involved primarily in inflammation. So when you have the non-selective NSAIDs, what they do is that they block the production of both the good prostaglandins, which protect the stomach lining, and the bad prostaglandins, which are involved in inflammation. And so that's how come when you take NSAIDs, you would have a problem with the stomach lining, and you would have gastritis or abdominal or epigastric pain. But when you take the selective NSAIDs, that's the Celebrex, it only blocks the COX-2 enzyme, which is specifically involved in the inflammation. So it targets specifically the issue.
Hello, Doc.
Yes,
Sorry to interrupt.
no problem.
Please, so with this knowledge, can we say that we can prescribe Celebrex?
Yes.
Okay, thank you.
Yeah. Because it just targets the inflammation. But the other thing too about Celebrex is that there's a risk of heart attack and stroke. And so if you are putting a patient on celecoxib or Celebrex, you have to screen them carefully, ask about cerebrovascular or cardiovascular disease, and you should monitor them closely throughout their treatment. Okay.
All right, thank you.
Then it's also important to look at certain special populations. So elderly patients, if you put a patient on an elderly person, so above 60, the risk of getting ulcer is high with this group because their stomach linings are not as robust or intact as you find in a younger person. Then also for children, some NSAIDs are not recommended for use in children. So example is diclofenac. And for pregnant women, some of the medications are pregnancy risk categorization B Oh, mommy. When I sit down, when I finish, I'll carry you home. Oh, Harry. Please, if it goes off, we'll reconnect with the same link. Okay, so let me take the opportunity to explain what the pregnancy risk categorizations are. So we have category A. In this group, studies have not demonstrated any risk. So there's no risk of these medications in the first trimester to the fetus and in other trimesters. So pregnancy category A medications are safe. So example is folic acid. Then pregnancy category B, this one, there is no risk in animal studies. So let me clarify. For pregnancy categorization A, studies have demonstrated that it is safe in the pregnant person, okay, and has no effect on the fetus in first trimester or any of the trimesters. For the category B, it is animal studies that haven't shown any risk, but there aren't adequate studies in pregnant women to demonstrate a risk. And so if you are using these medications in pregnancy, you have to be cautious and weigh the risk against the benefit. So an example is metformin. Then when you take pregnancy category C, there is an adverse reaction on the fetus in animal studies, but there are no adverse reactions that have been demonstrated in humans in research. But then if the benefits of using the drug outweighs the risk, you can give it. So an example is amlodipine. So what this means is that they've done studies in animals and they've realized that no, this drug is not safe for use in animals, but they haven't demonstrated any risk in humans. And so you can use it, but because of the issue with the pregnancy in animals, you want to be very sure that this patient really needs this medication and will benefit from it before you put them on it. So an example of this is amlodipine. Then for category D, there is a positive evidence of human fetal risk. Okay, but if the potential benefits warrants the use of the drug in pregnant women, you can use it despite the potential risk. So an example is losartan. Then as for category X, it is no. There is evidence of fetal anomalies in animals, evidence of fetal anomalies in humans. And so it is absolutely contraindicated. So an example is the anti-cancer medications, for example, methotrexate or